Welcome to the 365th of the COVID calls. This is a daily discussion of the COVID-19 pandemic with a diverse collection of disaster experts. My name is Scott Gabriel Knowles. I'm a historian of disasters at the Korea Advanced Institute of Science and Technology. I'm coming to you live from Daejeon, South Korea. Today, I welcome science, technology, and society scholar Hyomin Kim to discuss COVID, science, and culture in South Korea. Just a reminder, you can usually catch COVID calls live on weekdays at 6 p.m. Eastern Time. Just go to the COVID calls YouTube channel to watch. Today is a special COVID calls episode at 6 p.m. Korea time. You can hear COVID calls anytime, recorded as podcasts on Spotify, iTunes, Podbean, or anywhere you get podcasts. You can also keep up with COVID calls via Twitter using the handle at US of Disaster or at COVID calls. Please do help spread the word and send suggestions for future guests and future topics. And as always, please feel free to suggest yourself as a future guest. As of today, October 26th, 2021, there are 4,954,582 deaths from COVID-19 globally. That's according to the Johns Hopkins University Coronavirus Resource Center. I've been reading an obituary or a story of advocacy for those impacted by the pandemic, and I'd like to continue that now. The headline is A Scientist Who Came Out of Retirement to Help Fight COVID Loses His Own Battle. Written by Lindsay Coulter and appeared August 11th, 2021 in the Washington Post. Thomas Hodge III logged in from his hospital bed for what would be his last weekly Zoom meeting with some 200 scientific collaborators. Gaunt and unshaven, he conferred with the group on how to defeat the country's latest surge of COVID-19. The virus Hodge's body was battling a second time. The prominent immunologist died 2 days later of complications from the disease, from COVID-19. One stayed away. Mere hours later, a beloved granddaughter succumbed to kidney cancer. He was 69, she was 6. Dad hadn't been well, but he didn't want anyone focusing on him, said Leslie Turner, one of Hodge's daughters and one of Isabella Bondell's aunts. His spirit broke when he couldn't fix Izzy. Hodge, former director of immunogenetics at the Centers for Disease Control and Prevention, spent decades fighting diseases such as AIDS and Ebola. He opted out of retirement in early 2020 to focus on the latest global public health threat and co founded the Crisis Science Collaborative, a who's who of research and medicine that has since met virtually almost every week to share insights and developments on the pandemic. He was an ardent proponent of the country's mass vaccination effort, yet he cautioned against relying too heavily on the vaccines. He also warned against abandoning precautions such as masking and social distancing. He wanted people to wake up, to observe how serious this pandemic is, recounted his Crisis Science co founder Steve Winston, former chief scientist of the Idaho National Laboratory. At his home on St. Simon's Island, Georgia, Hodge beat the virus last year. He hoped that bout would stave off a future infection, especially because a medical condition meant he could not get vaccinated. Where he was again exposed to the virus is something his family will never know for certain. Despite his vulnerability, he was part of the vigil at Izzy's hospital bedside in Charleston, South Carolina, as her condition deteriorated. The little girl who loved unicorns and butterflies had been diagnosed with stage 4 cancer 13 months earlier. Like many men of medicine and academia, Hodge's obituary noted he confronted sobering truths about the limitations of the human body. When it came to COVID, Hodge took nothing lightly. He spoke out against Georgia's loosening of state restrictions in May 2020, calling the move premature. It is too soon in the midst of this pandemic, he told the Brunswick News. And he kept up his public education efforts, holding lengthy conversations with his pastor that their church, St. Simon's Presbyterian, videotaped and posted for members and the local community. First thing is, get a vaccine, Hodge urged in January, sitting in front of a whiteboard he used to explain what was available and how it works. He sought to tackle the virus from all angles, stressing the need for new ways both to prevent infection and to treat the illness it can cause. He was a proponent of an air treatment that aims to reduce viral particles from COVID, as well as an experimental blood purification device. That reflected the scope of his career. During the height of the AIDS pandemic, Hodge served as section chief of molecular immunology at the CDC's National Center for Infectious Diseases. He also held positions at the University of Alabama, University of Georgia, and Emory University. His name appears on more than 100 peer reviewed publications and book chapters. There are some people who, when they pass on, make us feel the overall intelligence and kindness in the world is remarkably less without them, said crisis science member Alexander F. Moore, an associate professor of environmental health at Long Island University. Tom was one of those people. The world and we are less without him, and I'm terribly saddened by the loss. Still, I'm grateful for whatever little time I was allowed to learn from him. His curiosity was never quite satisfied, his wife of 40 years recounted. When their third daughter was born, he kept the placenta for research. Kathy Hodge also remembered her husband's kindness. One Christmas Eve, before they had children, he had driven back to his lab to retrieve something and passed an inebriated man stumbling down the street. He took him home to ensure his safety. He had a big personality and made a lot of friends, she said. In the past month, Georgia has seen, and this article again came from earlier this year in 2021. In the past month, Georgia has seen a spike in COVID cases. As in other parts of the country, hospitals are again overwhelmed. Hodge again fell ill in mid July and spent his birthday as a patient. He died July 31st at a facility that's part of Southeast Georgia Health System, where the number of COVID patients increased sharply. Since his loss and that of Izzy, their extended family is trying to make sense of the double tragedies. All are holding fast to something that Winston, the crisis science co founder, shared in a tribute. His daughter observed that perhaps Izzy no longer had to be scared because Granddaddy, as she knew him, was waiting on the other side of the Great Divide to provide the solace that he no longer could from this side. The article was a scientist who came out of retirement to help fight COVID, loses his own battle, appeared in the Washington Post August 11th. Okay, I'd like to turn to my conversation for today. Let me introduce my guest to you, Hyomin Kim. Hyomin Kim is an associate professor in the School of Liberal Arts of the Ulsan National Institute of Science and Technology in South Korea. Her research interests include the co-production of knowledge, values, and identities and authority around technoscience. She has performed research projects in the field of public engagement with science and technology. She's the co-author or author of many articles. I'll just name a couple. She's the co-author of recent article, Public Deliberation on South Korean Nuclear Power Plants. How can lay knowledge resist against expertise, which appeared in the Journal of the East Asian Science and Technology, and Women and Men in Computer Science, Geeky Proclivities, College Rank, and Gender in Korea. It's got to be one of the best article titles I've seen in a long time. Also appeared in the Journal of East Asian Science and Technology. Hyomin Kim, it's great to see you on COVID Calls. Thanks for making time to talk today.
Oh, you too, Scott. Thank you for having me here.
I'd like to start the way I generally do, find out where you're calling from and what the pandemic situation looks like there today.
Right. So, as you introduced me, I work in Ulsan National Institute of Science and Technology. Ulsan is a southeastern city of Korea. And I actually live in a nearby city, Busan. And I receive text message almost every day from Busan Metropolitan Government. So, the message I received today, it shows there were 40 confirmed cases as of 11 a.m.
You've been receiving those text messages throughout the pandemic?
Yes, I think so. Yes. Sometimes I do not look because, it just comes so frequently. But today I checked.
I'm in Daejeon, and we get them every day at 6 o'clock, and sometimes more frequently than that. And when I first moved here in February, it was quite startling to get that kind of messaging because coming from the United States, we really had nothing like that at all. But over time, you become maybe not used to it is the right word, but it's just part of the daily activity.
As I said, I sometimes do not even look, right?
Yeah, absolutely. I wonder if you wouldn't mind sharing a memory of the of the pandemic, something that's particularly resonant to you about this time?
Right. So it was in the early phase, right? I was talking with many students and sometimes my colleagues, professors. And one thing I found out was young students were telling me, like, oh, I'm not really afraid of getting COVID-19, actually. I'm more afraid of, becoming known as the so-called confirmed case and thus as public nuisance. And then, senior professors were basically saying the same thing. And what they added to their comments was, this is a secret, kind of. And maybe this is just me. Maybe this is just my generation. But then, so many people from diverse backgrounds were basically saying the same thing. That really hit me. And that kind of, I think, inspired me to write an article about COVID-19. It's now under review.
I wonder if you could say a little bit more about that early phase of COVID and when things started to happen here in South Korea. Your assessment of the government's actions. I mean, it's even those details, those anecdotes you were just saying, are really powerful because it implies there was, strong social pressure already in place. But I wonder how you assessed the government's activities in that early phase.
Right. So that's actually one of the topics I address in my submitted article. And I don't necessarily see that it was just the government which put pressure upon people. It was really kind of emergent upon so many situations. And as I said, many people who thought maybe it's just me who's feeling this much social pressure, but then also newspapers always talking about confirmed cases and also how many of them were so-called super spreaders, right? And also I just looked it up, and last year, so 2020 October 26th, there were about 90 confirmed cases, and all news articles were talking passionately about how much of it is really from abroad inflow cases. So they are not, really Korean cases, right? So, in those kinds of situations, if you are one of, Korean confirmed cases, right? And if you are known as super spreaders, it depends on so many circumstances, right? Maybe it was one of those days you met many friends. Maybe it was one of those days you were traveling. So with that kind of perceived risks, I think people expressed that kind of fear, especially in the early phase.
And the mask issue early on, what was your assessment of that? In the United States, we got very limited information about how important it was to wear masks. And then the federal health authorities came in very strong and said by March that people should be doing that. But Americans perceived that, not all, but some perceived that as almost a reversal or confusing. I think maybe what it indicated was they were learning the science in real time and trying to communicate as best they could. I'm curious how you saw that issue of masks here in Korea.
It's actually so complicated. Yes, I think in Korea, there were so much more confusion than is usually known to the US or Europe or outside of Korea. Because it is simply thought, it tends to be simply thought that, Korean people were ready to accept masks. But it really was not. Because the guidelines for mask wearing in Korea changed a lot. I think you will remember if you were here, from last year, right? At the beginning, Korean CDC was also against putting masks onto everyone because the rationale was really like the CDC. Masks are for others, not to protect yourself, right? So people who already caught COVID-19, maybe it makes more sense, to mask those people, but not all the people, in the public. And there's also risks of not properly wearing masks. Maybe you will be, more contaminated by touching your mask, something like that, And all those, remarks were prevalent in Korea too, not just in the US. And people were confused because Korean CDC was saying something and the president was saying the other, and also Korean Food and Drug Administration was saying the other things. So there were lots of confusions. But one important difference was, I think, already since the mid-2000s in Korea, it was quite common to stock face masks in your households. And that has nothing to do with COVID-19. It had much more to do with air pollution. So, what I'm trying to say is we tend to focus on the differences so frequently when we discuss COVID-19 in Korea, in the US, or in so many other countries. But then we kind of forget how this COVID-19 responses had been in so much fluctuation, and also how the standard of risk has changed a lot within the same country as well.
One of the themes I know you were tracking throughout the pandemic is one that I've actually talked about on the COVID calls also with Hyung-Sub Choi and Jaewon Hyun earlier in the year. And that's this idea that was promoted in Western media. It was promoted in the UK by political leaders and in the United States, certainly by political leaders, that first of all, sort of like flattening Asia. So there's there's an Asian response to COVID, and that there's a so-called sort of authoritarian advantage. That
Right.
these are cultures that when the government says do something, people get in line. And I found that very distressing, in part because it's like completely geographically moronic. I mean, it sort of says Asia is one place, and that's a problem. But I think some people use that cynically. I think others in the West tried to use that as a rallying point or a way for people in the United States, for example, to look at what was perceived to be a successful response to COVID and say, we should do that, whatever they're doing. Let's do that. Again, it's very culturally complicated because it depends which data points you pull and at what point, as you just said, of the Korean response you want to focus on. If you focus on January of 2020, you're going to see something different from March of 2020. So I wonder if I could get you to expand on this issue of the so-called authoritarian advantage, what you think about that and why that idea got stuck in the United States a little bit in the pandemic.
Right, Scott. I think you explained nicely about this so-called Asian authoritarian advantage narrative. And that narrative was not just made by Western media. That narrative was quite widespread by Korean intellectuals as well. And let me just read one excerpt from The Guardian. I think this article came out back in May 2020. Quote, how did South Korea contain its coronavirus outbreak so effectively while the UK floundered? Their powerfully successful contact tracing scheme relied basically on state surveillance, as the UK does not have state surveillance. They were able to access phone and credit card data and work backwards through any infected person's life and outwards from any point along it. And this is an interesting part. We, the UK, we are a different country with a different population distribution and different history. I really loved this part.
Yeah.
This slightly condescending and proud kind of statement. Yes, but it's very hard not to look at the end results and say that the means were not justified. Difficult not to look at 259 deaths in Korea versus more than 40,000 and not agree that desperate times call for desperate measures rather than desperate bluster. So it's just like you said. So there's this ambivalence, right? Yeah. And this kind of, ambivalent, half congratulatory and half condescending comments, I think were made by Korean intellectuals as well. And I found, one opinion to be particularly interesting. So let me read it.
Sure.
Quote, the Japanese finance minister, Taro Aso, responds with one word when asked how Japan has dealt with the pandemic so much more successfully than the West. Here was his answer, Mindo. literally meaning people's standards. And this is a complex term. Mindo is used in Japan to indicate national superiority and can be translated as cultural level. Aso's comment has proved controversial even in Japan with that nationalistic tone. And Aso has been criticized for propagating national chauvinism at a time when global solidarity is of prime importance. And then, with pause, but if you remove its unfortunate nationalistic overtone, the use of the word Mindo by the Japanese finance minister does highlight an indisputable truth, namely the importance of civility, of collective action during a pandemic. So when people voluntarily follow hygienic rules, voluntarily, there is no need for controls or enforced measures, which are so costly in terms of personnel and time. So this opinion was written by Byung-Chul Han, who's a Korean-born German philosopher and cultural theorist. Actually, this particular piece I just read, it actually received less attention than his earlier writing. And his earlier writing mentioned Asian states like Japan, South Korea, China, Hong Kong have an authoritarian mentality, which comes from their cultural tradition, Confucianism. And so people are more obedient than in Europe, so they have more trust in the state. That was his earlier writing. And this provoked so many Korean citizens' anger because of his use of the word, obedience, because it, strengthens the stereotype that Korea is a flat place, with just technical superiority, but maybe not so much development in democratic state. So that really angered people. But then it got me into thinking again. Basically, Byung-Chul Han was making same kind of arguments when he was, talking about civility versus obedience. Those two had just different names. So I came to, really wonder when people were, responding to so-called Asian authoritarian advantage narrative with a, so-called counter narrative of civility. What are they really countering against? I don't think anything is in being debated here. And the thing is, this kind of apparent competition between civility versus obedience, I think it masks real question. The real question is, when Korea or any other country seems to be responding with, as I said, with so many changes and so many rapidly changing standards of safety, at whose cost and with whose responsibility and with what kind of, again, definitions of risks are we responding to this kind of pandemic? Those kinds of very complex questions seem to be absent when we sort of focus on this kind of flat question. Is Korea in general, as if it's static now, is more obedient or more civil?
So there's a lot in there, and I want to unpack some more of it, if that's okay. I mean, because these kind of cultural tropes, these essentialisms, were at play all over the world. And it, to me, it's unfortunate, but it's also this kind of some disaster research in the past has aspired also to talk in very, very general way. Americans do this, or Brits do that, Germans do this. These essentialisms, which are supposed to somehow be useful in a disaster because it allows us to count on certain kinds of responses. And so the idea, which I think could be very easy to authenticate if you were looking for it, that the United States had become a nation of rule-defying, crazy people, and that's just the culture. That's kind of like what you read from The Guardian, that this is the British attitude. We have to do things our way. There's an independence. That, I mean, yeah, you can find evidence of that. There's plenty of video of people going to state houses to protest mask mandates and things like that. But there's far more people in America who participated in the lockdown willingly, who still wear masks without a mandate, who've been vaccinated. It's not as high of a number as I would like. That's 64%, I think, of the population, but that's still that's a very large number of people. I guess my point is that these essentializing moves are very deceptive, but people do it anyway. And I wonder why. And I guess that's my question back to you. What purpose does that serve? Maybe bring it
Mhm.
back to the Korean case. What purpose is served by either characterizing South Koreans as obedient or civil, as if we needed a single word to characterize a whole complex country in the middle of a disaster? Why do people do that?
Right. So, Scott, I am also asking that question to myself, of course. And now let me talk more about my other topic
Hmm.
of my research. So it's about nuclear technology, as you introduced me. And last year, I was advising a master's student, and he was trying to write a thesis on nuclear waste storage in one Korean city, a very small Korean city. And he was from Seoul, capital. And his question to me was, so I wonder why these people in this small city in southeastern region of Korea, why are they not protesting against this storage, uh, constructed in their town? And his immediate follow-up question was, is that because these people were bribed? I thought that question was quite interesting to be put by a person who just came to this small city for a field work all the way down from Seoul. He has never visited this kind of small town before in his life. And I'll try to make a connection with that incident with what's happening in Korea now. As I said, just last year, October 26th, 2020, in Korea, confirmed cases of 90 people were something to be, really alarming and shocking. People had to make sense that, oh, this is not really Korean problem. If we can, really stop those foreigners coming, foreign inflows like you,
Mm-hmm. Absolutely.
then no, there should be less than maybe 20 cases, and we are controlling this pandemic unlike other countries. We are doing fine. Those kinds of narratives were something people really wanted to believe in, and that's why the media was so active in differentiating the inflows and actually happening in what's actually happening in Korea. But today, much more than 90 confirmed cases happened, but we don't really even know because those cases are not reported in primetime news anymore. Only I get those text messages from municipal government, but the sum of national sum is not broadcasted anymore. And also, even with so many confirmed cases happening daily, Korean government is talking about the so-called what's the word, living with COVID strategy, right? And it's being supported. And I guess my point is, when people support the so-called living with COVID strategy with the sort of agreement that we are safe enough, our situation is safe enough. Why do you think so? Why do you think differently when you were back in 2020, October 26th? I'm sure people have so many complicated reasons, not just one reason. Because so many things were happening with those small business owners, and I got really concerned about Korean economy, and also maybe vaccines are working, even though there are so-called breakthrough cases. I believe that we can control this risk. So even by asking people this simple question, why do we have different standard of safety last year and now? People's answers are really complicated, but that kind of self-perception is not easily projected when we look at people living in other region. So in this small city, when people seem to be living comfortably with nuclear waste storage, that looks quite strange to a person who just came from Seoul. Maybe they were bribed. There must be a very simple reason.
I I really appreciate how you've broken that down into the subnational
Mm,
level, and I think it really speaks to this, problem of risk perception,
mm,
which, again, if you try to characterize that nationally,
mm,
it that characterization is often doesn't work.
mm,
We'll have. I mean, I think to come back to the case of the United States, as I was trying to,
mm,
explain earlier, I could look at California, Florida, and New York State and tell you three very different stories
mm,
about risk toleration in
mm,
COVID-19, or probably about risk toleration in nuclear waste storage too. And
mm,
and so it seems like you're getting into some deeper and quite good
mm,
STS research terrain here about how risk perception then turns into policy, maybe even in the middle of a disaster, which I personally find
mm,
extremely fascinating. So I guess my question to you then is, as an STS researcher, how do you how do you work on that in real time?
mm,
I mean, throughout this, discussion, we've been talking about the pandemic, but then you come in and you do a more fine-grained the pandemic in this period in 2020, a little later in
mm,
2020, how it is now, risk
mm,
perception may be different. It's it's perceived differently in different parts of the country, but also national officials, as you said, they're not putting up the statistics anymore. That means
mm.
that those numbers are somehow no longer relevant to public needs for risk information. It's no longer part of their perception. So I'm curious how you approach this problem, but also as a problem of a disaster in time.
Mm, mm, mm. Yes, yes, yes. How do STS scholars do research in real time? That is a great question. And I think this is a particularly interesting and challenging time for STS researchers because, as STS researcher and you're a historian, right? We have seen so many cases, so many historical cases and also theoretical discussions over how the scientific theory we choose are not determined by evidence. They are always underdetermined. So there are options. Really, we have more freedom than we think, even with the matter of technical efficiency and also scientific fact. We have actually more plural facts than just one option that needs to be inevitably chosen. So yes, we do believe that we have choices. And then I would like to talk about Korean cases, but before I do that, we can talk about the U.S. problem. So deconstruction of facts. That's no longer an issue in the U.S., is it?
Hmm.
Because yes, people do understand that some established scientific fact can be challenged, and they also have witnessed how bad kind of deconstruction can happen.
Right.
Like climate change, is that really a hoax? Just by asking those kinds of questions, whom does that contestation really benefit, right? So I guess people still do care about facts, even after understanding that facts can be, socially constructed, and not just socially. All these contingencies are important in our acceptance of facts, or as you said, toleration of risks, or our choice of not tolerating certain risks. So all those kinds of choices can be remade. But then after making one choice, we also need some faith, I would say, right? Some kind of belief system that will not be so easily, mm, challenged or so easily put up to test, or we need some. I think people need some kind of standard when people talk about facts, right? So when I said this is a particularly interesting and challenging time for STS researchers, as I began with in this talk, the standard seems to be too rapidly changing. That's my feeling, really. Yes,
Mm.
and it's really confusing, right? I still remember how Korean CDC was not really active about promoting masks. I remember it, But then, it's kind of hard to remember all those kinds of changes because you need to kind of adapt to what's going
Right.
on now.
Right. So that moving target
Mm,
of science communication
mm,
has been weaponized. You used the term deconstructing facts a minute
mm,
ago, and I think that's what people who do the kind of research that you do are quite good at that, talking about
mm,
how a scientific fact is made and how it goes out into the world and does work, and then how it can be deconstructed. But we've also seen what happens when that becomes weaponized, when that becomes a
mm,
tool of political partisanship or even a tool of war.
mm,
Um, and I think that's not that different from your other work around sort of the communication problems of risk with nuclear power
mm,
and nuclear waste. Have you learned anything, or do you think about that nuclear risk communication differently now? And I ask that for two reasons. One, because as you just noted, public health officials have had to change their story periodically
mm,
throughout the COVID pandemic, both in South
mm,
Korea and the United States. And also, we've seen in this disaster what happens when that uncertainty
mm,
becomes a tool, a cudgel from those who
mm,
would like to do damage to a public health system. So that's documentable, but I wonder how you use that then. Like, what do you want to do with those findings, and how does that make you think about your previous work?
mm, mm. Yes, that's a complex question you put quite nicely. So let me again comment upon my previous work. And
Mm,
this time it's about 2008 Korean protests over US Korea Free Trade Agreement. And the topic of contestation was especially of the US beef, which was known at that time to many Korean people as risky objects that can cause, BSE, mad cow disease. And again, that was back in 2008. And the political regime at the time was right-wing, pro-American Lee presidency. And the truth is, so-called safe US beef was vigorously attacked by citizens making street protests at that time in 2008. And Korean intellectuals were quite excited. STS researchers were also quite excited. And STS researchers in Korea wrote numerous articles discussing how Korean citizens were so active in, again, deconstructing and reconstructing this powerful network of scientific facts, global standard of safe enough US beef, US hegemony, pushing FTA, and the Korean right-wing government's authorities altogether. However, I think the protesters' weapon was not this, STS perspective of underdetermination. At that time, the protesters were really serious about, the real risk of US beef, not, any facts can be deconstructed. So when I interviewed, protesters 10 years later, most typical comments I would get from my interviewees was, I feel really proud that I was part of that political resistance. Yet the claim that the US beef causes such serious health risk, that was never a significant driving force for me. And of course, I know that it is safe. Those were, typical comments I would get. So now I don't know what's in their minds, right? But what I can see is that, even if some people really believed that the facticity of safe US beef was something, that can be deconstructed and, that is really underdetermined, at least now they don't want to, publicly talk about it, at least. Yeah. So the thing is, again, 10 years ago, Korean STS researchers were so excited about the protests, not just because people were rising against this right-wing government, but also because it seemed like lay citizens were questioning the transcendent status of the fact as given
mm,
outwardly and written, something written in stone. So this scientific authority being reconstructed. Yet, is that really right? that was the question I kept asking to myself. And, not just is that right, but, what STS research can really do, right? When some facts are being contested while certain, areas of, how can I say, how certain boundaries of facts versus non-facts are still being kept. Some
Mm.
questions are asked, but some questions are not asked. So those kinds of still ongoing boundary work, how is that kind of selection being made, and what kinds of questions are not asked? That's, I think, what I really want to pursue when I look at any kinds of risk issues, be it nuclear power, BSE, or COVID-19.
When you're describing those protests, two words that I don't hear come to mind are obedient and civil.
Mm-hmm.
In other words, when you recapture that history,
Mm.
that's a pretty powerful correction to this notion again of some sort of society that falls into line whenever health authorities or whenever the United States government says, "Hey, this is just a risk you have to tolerate."
Mm-hmm. Right, you're right. Yes. So Korean, society does have lots of memories of standing up against any kinds of, established authority. So that's probably why Korean people, especially after the so-called candlelight revolution and this new regime, are reluctant to accept any kind of comments that describes Korea as the continued place of Confucianism. But then, again, when sort of the same kind of comment is made with the congratulatory remark upon Asian civility, it is still so well received. And also, it is right. It is very. It is one thing to resist against the political regime, but also, the fact that scientific truth can be established, and if you were wrong about that, I said, yeah, then
Mm.
that was not important for you from the beginning. So that
Mm.
kind of rationalization is still based upon the firm understanding that there is a fact.
That there is something that's a
There
fact.
is
Yeah.
something. Yes.
Let me just remind everyone that you're listening to COVID Calls. I'm having a great conversation today with STS scholar, researcher Hyomin Kim. And I want to turn to make sure there's another topic I want to get to, which is vaccines. And I was talking with Emma Koval yesterday, the medical anthropologist who's based in Melbourne. And I've been thinking about that call a lot. She had just come out of something like it's the longest lockdown anywhere in the world.
Mm.
And because the Australian government had been pursuing a zero COVID approach, so they had been
Mm.
an even more aggressive approach, or you might say an even lesser toleration of risk than South Korea. But similar to South Korea, they compared to some other countries, there was a long period of time in which vaccines were not available.
Mhm.
And so that was also a factor in health decisions, in public health decisions about whether or not to pursue the lockdown, what kind of tracking and tracing need to be put in place. So interesting correlation there between Australia and South Korea. And I've been wanting to ask you about this too. I guess I want a sort of general question, like how you see the history of this COVID vaccine aspiration in South Korea. We're in a dramatic phase of it now because the vaccination rate has gone up incredibly dramatically in the last 30 days. But
Mhm.
that's after
Mhm.
a long period of many months of waiting and quite slow movement. And
Mhm.
so I wonder, how have you been tracking this? What are your thoughts about that? Are those
Mhm.
even the right words to use? I mean, I'm using time reference like fast and slow as if they have some real meaning in the world. They're always in reference to other places. So maybe you would use different words, but talk to me about your sense of the vaccine goal in South Korea.
Mm. Mm, mm, mm. Yeah. Personally, I was not really surprised by Koreans' fast catching up with vaccination because anti-vaxxer movement was never a serious social kind of happening in Korea. Never. Yeah. There were some cases, but usually those people were not talking about inalienable individual rights. I guess Korean anti-vaccine movements were much more about how some mothers are showing concerns over their responsibilities if side effects happen to their kids. And also there was some connection with Korean traditional medicine. So those kinds of movements were generally regarded by larger public as kind of, how can I say, retrograde, not so modern kind of movements. It wasn't perceived to be, anything about political right. So Korea does not really have, that kind of memory with anti-vaccination in relation with political kind of arguments made against government or for government. And this time, this particular government, again, it won the election quite unexpectedly, right, after the impeachment. And with a generally high approval rate, the government tried, I think, its best with tracking, but then it was slow in importing vaccine. So people are kind of waiting for the vaccine to come here. And then, of course, with Korean system of health insurance, right? It's available to everyone, and Korean people were kind of used to going to the hospital and getting inexpensive care, and especially they are really used to this idea that the government is responsible, right, for providing us affordable health care. So the government not providing vaccine was an issue. Providing vaccine, that was kind of expected. But then again, I want to emphasize this is, again, not about compliance or civility or anything. And it's also not about Confucianism. I guess it has much more to do with, 1970s Korean health system established since 1970s.
So that period of waiting is one I wonder if you can say a little bit more about that. So the anxieties within that period. And how we discover those, because again, I think it's really important what you're saying here, and I've heard some people comment on this that say, oh well, countries that are wealthy countries that don't have vaccine, they're waiting, and so this once again proves these ideas of civility, or that why aren't people rising up in the streets and demanding vaccine? Well, it must be something cultural. About obedience or deference to authority. Again, sort of reaching for these essentialist kind of explanations of it. But there have not been riots in the street, or I haven't seen them in South Korea demanding COVID vaccine. But the anxiety is there. So I wonder how you track that. Like, where do you locate that?
Yes. If I write about that in my next article, I would start with the current administration and the geography of national level media first. How media discourses on vaccines, especially pro-government media, newspapers and broadcasts, they emphasized risks of vaccines before vaccines were introduced to Korea. And I'm not saying that those risks are necessarily I'm not saying that those risks are completely false. I'm not saying that those risks are need to be accepted by everyone. What I'm saying is, selective risks get to be emphasized depending on context, right? And it is true that these mRNA vaccines have gone through unprecedentedly short period of testing. That is true. So I can kind of understand, as a STS researcher, how you can sort of, unpack some kind of risks. But then it really depends on, who's making those kinds of remarks, right? Under what context, and again, whom does it benefit?
Right. And I wonder how you, just in terms of information, what do you think about the Korean biotechnology sector
Mm,
in light of this, waiting
mm,
period? Has
mm,
that, do you think it now will rise to a higher level of national priority? I've been thinking about this on my own campus at KAIST. I wonder if you think about that at your campus, educational centers that receive government funding to be at the cutting edge of technology. Will it be acceptable to have another pandemic and not have a Korean produced mRNA vaccine? These are the kinds of questions I've been asking in these last months. I wonder what you think about that.
I think you should ask that question to, those life science professors at KAIST, right?
Yeah.
They should be really asking those questions to themselves. And I also wonder why they are not more active in, presenting their positions to the national media about, Korean possibilities or capacities or potentials of producing Korean own mRNA vaccines, because I don't see many. We hear a lot about therapeutic drugs, right?
Mhm.
But
Right.
about vaccines, maybe there are more hurdles. As a previous bio major, I can have some speculation, but my question is, if you have some hurdles, why don't you speak about it, right?
Mm.
Is it about clinical trial? Do you need maybe different kind of regulation, or do you need more governmental support or anything? It seems like so many academic funding is these days channeled at least to something connectable to COVID-19 issue. But
Mm.
the really important question, right? mRNA vaccine made by Korean biotech companies and university professors. What seems to be the challenge, it's remarkably absent, I think.
Mm.
And that's really surprising because, Korean government is quite interested in promoting life science, of course.
Absolutely. I
Mm,
had this conversation the other day with a colleague. I was asking him the same question I just asked you,
mm,
and one of the things that kind of came out of that conversation was also just thinking about profit motive, and that, vaccines don't historically, vaccines are not that's not a profit center for a pharmaceutical company,
I see.
right?
Mm,
And but right now, a company
mm,
like Moderna in the United States, I mean, they're minting billionaires weekly because of, the demand that's out there for
mm,
this drug. And so, I mean, that's one layer of this. Maybe it hasn't been a national economic priority,
mm,
built on the assumption that if vaccines were needed in a large number, that they would be made available globally, and that
mm,
it would be easier to purchase them in the global market, which seems
mm,
to have been the Korean strategy in COVID-19. I want to ask you, just, I know you're not expert in this particular area, but I would like to
mm,
have your opinion on it. If you think the United States Korea um, allyship, political relationship, has been damaged or affected in some way
mm,
by the Biden administration's unwillingness, basically, to make
mm,
mRNA vaccines available,
mm,
or to make the
mm,
intellectual property
mm,
available to South
mm,
Korea.
mm. Has it affected Korean-US alliance
Relations, yeah.
relations? Well, I am not sure if it will make a serious impact because uh, again, it's the national level media, right? Reporting certain things more importantly and less importantly. And as you mentioned, when Korean people were waiting for the vaccine, Professor Hyun Jae-hwan, he also received that Johnson and Johnson vaccine, right? Yeah. And it was quite well known that it was given by the U.S. government. Yeah. And then the intellectual property issue that has been in the media a little bit, but I think much more people are much more interested in how Korean government is trying to move ahead to this living with COVID-19 strategy, and the vaccine intellectual property is not becoming a politicized issue yet, but we are
Mhm.
not sure. Yeah.
So just a few minutes left
Mm,
on COVID calls today with Hyomin Kim, but I did want to get to, you just mentioned the living with corona
mm,
strategy. Curious how you think that's going to play out, particularly somebody like you who's always got your antennae up to like risk communication. And
mm.
I, if you look at how that's played out in other countries, that means the case number is going to go up. Now, I mean, I
Yes.
know there's a calculation here that the vaccination rate will allow the with corona strategy people to be more out and about, more social. That maybe the vaccination rate has achieved a level that makes it where we won't have an increase in the infection rate. So it's
Mm,
unknown, but that's certainly potential, and that maybe people there will be breakthrough infections for vaccinated people. So
mm.
I'm really curious to see how that plays out, and I guess it'll be rolled out here in Korea starting in November.
Yes,
What are you
yes.
anticipating?
Yes, there will be so many complex factors interacting with each other, right? Yeah. It won't be just one change, but so many changes, like, the opening hours of restaurants and so many other places, and how many people can get together, right? And also with the so-called vaccine pass, right, where you can go and even if you are not vaccinated, you need to show that you are negative with your PCR results, things like that. Yeah. So with all those combined factors, right, how will people change their behaviors and perceptions, right? Uh, or I can say is, we really need to see what will happen in this winter, right? With colder weather and people usually staying in more confined areas. Yeah. But then again, it's not just one factor, but what I'm kind of worried, what I'm kind of getting concerned is when things go worse or better.
Hmm.
Again, it's I think there has been tendency, right, during this COVID pandemic, to seek kind of very simple explanation, like this vector worked, right? And then that kind of explanation is not easily challenged, because when you try to challenge that kind of simple explanation, you kind of come up with another simple explanation, right? It
Right.
was not this but that.
Yeah, you trade one for the other. Yeah, exactly.
Mhm, mhm. So that's the thing I'm kind of worried about, because this is again on very interesting and challenging time for STS researchers, and STS research has always been about emerging relations, negotiations, and choices and complexities. But then we really kind of want when I say we, people really kind of want straightforward kind of explanations in times of crisis and confusions. So what STS can do, yeah, that really is a remaining question to me, and I think to you.
I think it brings us back very helpfully to kind of where we started, which is to provide counter narratives to this idea that of Asian obedience to
Mm,
authority. Again, as if Asia is some sort of scrutable place, and we can say Asians are something, just like we would say Americans or something.
mm,
Um, the correction to that doesn't just happen because people achieve some sort of enlightenment.
mm,
I mean, I think that's work.
mm,
I mean, I think that's conversation, and the
mm,
kind of work that you do, which has to provide the complex counter narratives to that.
mm, mm.
Now,
Right. Yeah. It's
getting
not about congratulating or criticizing anything. It is really about revealing the multi-sidedness of everything. And any kind of explanation is always partial, and we need to bring out that situatedness. I think that's what STS research can do.
finding policymakers who can take on board that kind of complexity and then
Mm,
feel confident bringing that to the public, that to me is one of the great challenges for STS. What we now hear used as term is engaged STS, I think very much aspires to be in the fight along those lines. So
mm.
we need to wrap up, but let me just ask you just briefly, what are you working on now?
Yes. I am working on how the notion of physical fitness has changed in Korea.
Ah,
So this time I am finally working on benefit, not risk.
okay. Wow. Well, COVID will have a role to play in that discussion, I suppose.
Actually, yes, yeah. Lots of people are interested in physical fitness, yes, and they are people are worried that COVID has added some pounds on their bodies, right? Yeah, but then what kind of exercises can be considered to be safe, right?
Hmm.
And gyms are now allowed to take people who are vaccinated, and people
Right.
can run more than 6.5 speed on treadmills. So again, there are so many intersections of government regulations, people's perception of safety, and what is good for their body and what is good for population. Everything.
Just a reminder, you've been listening to COVID Calls, and you can usually catch COVID Calls at 6 p.m. Eastern Time. This week, doing a number of COVID Calls on Korea time. Please join me at 5:30 p.m. Korea time tomorrow for my discussion with social psychologist Orla Muldoon. We'll be talking about social psychology and the COVID-19 pandemic. So please do join me for that. And I want to thank my guest, Hyomin Kim. I knew this was going to be a lively conversation. I'm just such a fan of your work, and I really appreciate you taking time today to talk about this with me.
Oh, thank you, Scott. Again, it was a nice conversation with you, and I look forward to speaking to you again about any kinds of risk issues. All right.
Stay healthy, everyone, and we'll see you next time on COVID Calls.